Hello, welcome to our fourth episode of Hello Health. My name is Delane Jones, and I am an employee here at the Health Department, and I am in the communicable disease area. I am in the schools here, at the high school, middle schools, the university, and at JDC. I will allow my coworkers to introduce themselves.
Hi, I'm Samantha Tillman, and I am in the Health Education Division, and I focus on reproductive health education.
My name is Joy Talent. I'm a nurse in the Family Planning Clinic here at the Health Department. I also run the Pregnancy Test Care Clinic.
Just a couple of house rules here. Mics should be muted except for our presenter. If you have questions or comments, we have the comment box and we have the chat box available. All of the links and resources shared during the meeting will be posted on our website at cumberlandcountync.gov. If you happen to miss an episode, you will be able to go back and rewatch our shows, and that's going to be on CCN TV or YouTube, Cumberland County, North Carolina TV, 24 hours a day channel for that. It airs 7 days a week on Spectrum Cable Channel 5. You can stream CCNC TV on the CCNCT app on Roku, Apple TV, and Fire TV for free.
All right, and then today's topic, what we're going to be talking about is the Teen Wellness Clinic, our Family Planning Clinic, and Sex Ed for All Month. So the first thing that I want to ask is, Joy, so you are a PTC nurse. What is a PTC nurse?
So PTC stands for Pregnancy Test Care. It is under the Family Planning Clinic here at the Health Department. There are many different clinics and services available here at the Health Department. Pregnancy testing is just one of those things you can come here to get. And I am the nurse that is responsible for that clinic. So when you come to the health department, you can ask for a pregnancy test, and then you will be placed in an appointment, or, when you call and make an appointment, you'll be put into my clinic if you think that you're pregnant and need to know the answer to that. So what happens then is, we do lots of education, or I do in that clinic. You not only get the result, are you pregnant or not, but you also will get education as far as how to have a healthy pregnancy if you are pregnant, what to do if you're not pregnant, as far as if you want to then get on birth control to prevent that from happening, or if you're trying to get pregnant, I talk about ways to help in that, to get yourself healthy to get pregnant. And also some education as far as birth control,
Okay.
Which brings us back to the Family Planning Clinic.
Yeah. I had just had to ask because, there are a bajillion acronyms in the healthcare world. And I had heard PCT nurse before, and I had no idea what it stood for. So
Pregnancy test care.
Yeah. So now, yay, we all know.
On the same page.
Yeah. So the first thing that I want to ask about, our topics today is exactly what is the Teen Wellness Clinic?
Okay, so it's really a wonderful thing that we started a few years back with a grant that we got. The Teen Wellness Clinic is geared specifically for teenagers, like it says, 12 years old up to 19, or through 19. The day you turn 20, you would transition into the Family Planning Clinic. There is lots of different components to it. Any girl or boy, young lady, young man from 12 up through 19 can come to the Teen Wellness Clinic specifically for STD testing, sexually transmitted disease testing. Girls can also get birth control. Now, with the males, we do offer condoms, and we can talk about ways to be responsible in that manner. So that is available as well. primarily it is, for teens. But I would like to say too, it is a law in North Carolina. I want the teens to know this, that anybody over the age of 12 can come to our clinic without your parent. You can do that by yourself. You can make the appointment and come, for privacy reasons, anonymity reasons. Now, I will specify that if you disclose to us in those clinics, we do keep your privacy at utmost importance. And we will tell you that what you share with us is private, but if you disclose to us anything having to deal with abuse, sex trafficking, situations like that, there are certain things that we are bound by law to report to the Department of Social Services. So we will do our best, though, to keep your privacy. We do encourage the teens to, disclose to their parents what their plans are and what they've done to proactively protect themselves, because we believe that communication in families is key for the teens to have optimal health, mental and physical.
Yeah.
But you can come here of your own free will, and do it yourself without your parent.
Another question for you. Since these are teens, when are they basically able to come in since they're in school? What are there hours that they can come
That's
in?
a good question. So we do have every day through the week, Monday through Thursday, available appointments starting at 7:45. We have a little break for lunch, but then it goes, our last appointments at 3:00 in the afternoon. And then we do have second Tuesday of every month, we have a late clinic that runs until 7 p.m. So if it's something that, mom's driving you and she works till 5, there are appointments after 5 on that date for the teen clinic specifically.
Yeah. I really do love that we encourage our teens to communicate with their parents or guardians or caregivers, just so that, your overall health, like your family is a part of that, helping you make those decisions. But let's say, we have a 14-year-old come in, they think they might be pregnant. They don't want their parent to know, but somebody sees them here and their parent calls us. Like, what happens with that?
Great question, because we do run into this a lot. We cannot speak to anyone about any patient's care here, even whether they've been here or not. Whether they come in our lobby, on the phone, we do not disclose that information. So we cannot, if somebody calls and says, hey, I heard that my daughter was there, I cannot tell you that information, ma'am. We cannot share that with you. So that is never a concern. There's also, when the teens come in to register, this is with any patient, teens on up that comes here, you can choose to be a confidential contact. That means you can say whether you want to get anything in the mail from us, whether you want phone calls. You can, pick and choose how you want us to communicate. So if you say, I want to be a confidential contact, then we can't contact you for any reason. And also, it's always in place, if somebody were to contact us about a patient, we will never share that information.
So totally confidential.
And I wanted to say too, so when you come in, even if mom, sister, friend, whoever comes with you to your appointment, they are not allowed back into the clinic.
Okay.
So I love that because it is a safe space.
Right.
We here at Cumberland County Health Department and the Women's Health Family Planning Teen Clinic are a safe space. If there's something going on and you can't say it around anybody, you have that moment to say, XYZ is happening at home, I need help.
Right.
and we can get you the help that you need that day right away. We have resources in place for domestic violence. And domestic violence takes all kinds of different forms. You know, it's not just between a husband and a wife, boyfriend, girlfriend. It can be mom to child, or, you know,
Right.
whoever,
Mhm,
sisters,
mhm,
brothers, against each other. So if there's something happening and you need to ask for help, that is afforded to you, because we do not let anybody come back into our clinic with you. That is a safe space.
That is great to know. And I
Yeah.
think that would open up teens being more apt to come into an environment like that where they know it's going to be confidential. There's not going to be a phone call.
Mhm.
Nobody knows my information. So
Yeah, because I mean,
that's
I
great.
even remember being a teenager and going to a doctor's appointment. Of course, my mom was with me, and they would ask, "Are you sexually active?" Like, you don't want to answer that question in front of your
Right, in
parent.
front of your mom.
Like, I don't like, even if the answer is no, I don't want to talk about that with her right now. So I really love that. That's completely confidential. You did mention that the teen clinic and family planning are safe spaces. So do we have teens who identify as LGBTQ plus come in as well?
Absolutely. And everyone is welcome, of course. And we do have things that we can talk about. You know, with same-sex partners, there are barrier methods and birth control methods that we can use for different things. So we can definitely talk about that. You know, anyone who is coming seeking reproductive health information, information on how to be safe is welcome. That's universal, right? We all want to be safe. We all want to be healthy, hopefully. So that's definitely welcome here.
Perfect.
Yeah, very good to know those answers. I know part of our job, Samantha and I's job, on the teen night when you have late clinic, we've been offered to come over and to do a little bit of extra counseling, or if a teen wants to talk with us, we're able to do that. So, you know, sometimes you can do your part as providers and things like that, but sometimes teens will need a little bit more, you know, coaching or whatever you want to call it, where they can open up a little bit more. So I've had the opportunity to come over, you know, maybe once and maybe talk with the teen of something going on, not clear on what happened. Am I pregnant? Am I not pregnant? So that was very helpful. So I like that part about the late teen clinic, where they can come in after hours, or maybe they see this provider every time they come in to see a different person, to be able to open up a little bit more if they're struggling on that particular day. I think that's a great service that's provided for them to talk to additional people.
Yeah, because sometimes, I mean, even with adults, sometimes we have white coat syndrome, where we're just really uncomfortable or we're really anxious around healthcare providers. So having health educators come in, you know, we're not in scrubs, so like we don't look like a typical healthcare professional, but just offering the extra support, extra advocacy, because sometimes, especially if someone, I mean, I think it's great that North Carolina has that rule where you are 12 years old, you're responsible for your health. You can come in for confidential health care, but sometimes at 12 years old, you don't really know how to voice, like you don't know how to put into words what you need. So I really do love that we are able to go over into the clinic to kind of help out and talk with those teens.
Well, it speaks to the mental health element of what we do, which I think really needs to be focused on as much as we can.
Right.
You know, we're not only looking for physical health, but mental health has a lot to do with the wholeness of a person. So, you know, as many opportunities I think as young people have to talk about what's going on with them, the better, right? And information is power. So, you know, you guys have really unique tools that you can use with the iPad and all kinds of stuff like that. It kind of brings it down to their level where, you know, it's not so much I'm getting poked and prodded. it's more of, hey, let's just have a chat, you
Yeah.
know.
Mhm.
Absolutely.
You make it more informal, and that's something that we try to do across the board there in family planning in general. And then with the teens, our clinic is uniquely designed for teens. With that grant money that we got, it was really cool that we could form the space of the teen waiting room.
Okay.
And that's a
Mhm.
place for them to go and feel comfortable so that they're not sitting out with the general population. There's not a
Mhm.
bunch of people. It's a little bit more snug and secure. It's brightly colored. There's all
Mhm.
kinds of cool stuff on the wall. You know, there's condoms in there you can get so that somebody's not staring at you, or you don't have to ask for it. You
Okay.
help yourself.
Mhm.
You know, there's information on the walls you can read while you're in there, and a TV. So that is geared to make them feel more comfortable again. That, hey, we do see you.
Yeah.
We're here for you.
Mhm.
We want you to come to our clinic and feel like there's a place for you here.
Mhm.
And then the entire clinic is brightly colored. We got to, excuse me, paint every room in these nice bright colors
Okay.
so that it's not like your typical, you know, straight laced, you know,
Mhm.
whitewashed
Yeah.
doctor's office
Right.
where you're feeling all clinical and, you know, stainless steel and cold.
Mhm.
You know, it's warm and inviting and exciting for the young
Mhm.
folks to come in, and we really want teens to feel comfortable in the knowledge that there's no judgment here.
Yeah.
You know, we're here to help you, meet you where you're at, and try to help you to voice what your concerns and needs are, because we all live in the real world. Things happen, right? And we want to be here to give you the resources that you may need if you're not ready to get pregnant.
Mhm.
If something has happened and you need testing, we can provide that for you as well. A safe place to talk if you need that. You know, different people that you can talk to. Sometimes you don't vibe with one person,
Right.
maybe the next person will.
Yeah.
Right.
So there's options.
Yeah.
And that, I think sometimes teens, you know, they don't feel safe in their world. You know, there's all kinds of
Mhm.
stuff going on and information coming to them and bombarding them. They have to be,
Mhm.
you know, one person at home, one person at school, you know, and put
Right.
up this. But here, we want you to be comfortable. We want you to be safe. So
Yeah.
no, there's no judgment here, and that we are here to help.
I did have
Yeah.
one question. When you mentioned when the teens go back in the exam rooms or whatever,
Mhm.
they go just by themselves.
Yes.
Now, what if they, one of the moms or the guys that come in have a child, an additional child with them? Are they able to bring them back, or do they need to provide babysitting ahead of time, or is that an issue, or how does that work?
So we are a child-free clinic. We
Okay.
do ask that the patient come by themselves if possible. Now, we also want people to get their health care and what they need.
Mhm.
So I can speak for when I work in my pregnancy test clinic. I do have that a lot where young moms come in with the other child. I try to make that a judgment call. If you need this pregnancy test result to move on to get your Medicaid so that you can get your prenatal care, that's important.
Right.
And there may be a situation where, you know, you didn't have anybody watch the child, and you only can come here on this certain time, certain day, transportation's an issue, what have you. My clinic that I run, I have a separate office. We're not in a medical setting, not right there on the main family planning clinic. I can sometimes say, okay, just bring the child back. We're kind of off by ourselves in an office. You know, it's not going to be disruptive.
Okay.
However, there are safety concerns with letting a small child, especially one that can't be like securely strapped into a stroller, into the general clinic, because there may be something while mom's getting an exam
Mhm.
that the
Okay.
little child can get into,
Mhm.
and we definitely do not want them to get hurt.
Okay.
So we do have resources for childcare if we know in advance. If you just voice that when you're making your appointments, then we can work with you to get a drop-in childcare set up for you. That's something new that is being rolled out. I think is a wonderful resource because there are a lot of times where we would have to turn a patient away or reschedule because they did come with their child. Our goal is for you to get the health care you need, but we want to do that in a safe manner.
Right.
We don't want you to be worried about, your child getting hurt while they're here. So we have to think about all angles of it, but that is available if you need it.
Okay.
Good to know.
So other than you had mentioned that, the teen clinic is for people 12 to 19. Other than age, is there something that would have us move a patient from the teen clinic over to family planning?
No, not that I can think of.
Okay.
Because in the teen clinic, it is the family planning clinic for teens.
Okay.
So everything that we do in the family planning clinic, we do basically the same things. Except for there are age requirements. I do want to clarify one thing. I'm glad you brought that up. For people, there are age requirements for pap smears. Now, there's a difference between a vaginal exam and a pap smear. A lot of people think that when you get a vaginal exam, you're getting a pap smear. Not true. Pap smear is the name of a specific test where they gather cells to look for precancerous changes. So that is only done if you're 21 and above. So, the teen clinic, those ladies are not going to be getting a pap smear.
Right.
They can get a vaginal exam if they so choose for STD testing. Now, there is a great thing. You can get STD testing without a vaginal exam. So from time to time, we have young ladies come in that want birth control who've never had sex. But they want to proactively take charge of their own health and get on a method because, things happen. Something might happen. They know that they're with a boyfriend or whatever. They want to go ahead and get on a method for whatever reason. And they want to make sure they're healthy. If you've never had sex, a vaginal exam can be kind of traumatizing, invasive, whatever word you want to use. You may be very, very scared of that. You get to choose. You get to take control of your health and say, I don't want to do that vaginal exam today.
Right.
There are ways to do STD testing through your urine. You can also do a self swab in a lot of situations, so that it takes that fear of that vaginal exam away, because that can be a huge fear if you've never had that done before. Our nurse practitioners are wonderful. They're very well versed on the one-on-one time with the teens and taking care of our teens. So they will definitely bring that up, as an option if you need that done.
Okay.
That's good to know.
So basically, our family planning clinic, you get the same services, except added pap smear if you're 21 and up. But it's still judgment-free, shame-free, confidential. Like it's the same.
Absolutely.
It's the same services. Just you get to be a true adult.
When does that happen? Let me know, because I don't know if I've reached that yet.
But I do. Yeah. So I though I work at the health department, it is important to remember I'm also a resident of Cumberland County. So it's really great to know that the family planning clinic is here and that, we offer so many services in a very comfortable environment.
And it's easy. Availability is good right now. We have lots of open appointments. So please come out. Life is hard for ladies. We all have goals. We have million things to do every day. If you're not ready for a child right now, that changes your life in many different ways. To bring a baby into the world, it's a lot to deal with. So if you're not ready for that yet, you're focusing on other things, we can help, with your family planning needs. We offer the family planning clinic, of course, starts at age 20. So then, we have a lot of teens that transition out from the teen clinic and keep coming to us for their reproductive needs and women's health needs into adulthood. And we go all the way up to menopause.
Okay.
So, we have ladies that are still on a birth control method because they haven't gone through menopause yet into their 40s. And then we have a resource for those ladies in our BSEP clinic. That's the, cervical breast and cervical cancer care program that is specifically for ladies without insurance, geared toward 40 and up. So there are resources for all ages, just about, of women to come in and get birth control, have their women's health needs met. We do stress self-breast exams as well. There are ways to get mammograms if something is found. So that's another thing to talk about, with our family planning clinic. If for some reason you have an abnormal pap smear, we do have follow-up for that. We have a nurse that's her job to follow up with our abnormal pap smears and let you know what is available for you to do, what happens after that, what do I do now, kind of thing. So it's not just birth control. Our primary concern is birth control, but we also focus on women's health as well.
Yeah.
And, there's other things that happen there. We also do hemoglobin A1Cs. If people are a certain age and a certain BMI, we do check that. That is a test they can do through your blood to see if you're pre-diabetic or diabetic. Our nurse practitioners bring that up to our patients if needed, and then let you know what resources you can seek for that. The health department has an adult health clinic, so we do a lot of referrals to them. That's run by Wade Stedman, a great partner that we have. We do referrals over there all the time. We find ladies with high blood pressure, pre-diabetic or diabetic, lots of different things that we focus on in that women's health. Under that umbrella. And any given day in family planning, we have, 2, 3, sometimes 4 clinics running at the same time.
Wow, you're busy.
So
busy.
And-
but I mean, we're a one-stop shop.
One-stop
Right.
shop.
Come
You
and
get it
Yeah,
all done. That's
exactly.
exactly right.
So we did talk about how, birth control services, birth control education, things like that are super important. So what if we do have a teen who is pregnant, or we have a teen who is a parent? Do we have any special programs or resources for them?
So there is the adolescent parenting program that is a great resource. We also have pregnancy care managers. So the piece of that is, if you come in, you have a positive pregnancy test, now what? We have a maternity clinic, excellent clinic here at the health department. And I'm not just saying that because I work here. But I personally, in years past, was pregnant years ago, back in the day, and worked in the maternity clinic. And also, so I worked here pregnant and went to my private doctor. So I kind of got a unique sense of the difference between the two and what is the differences. And I'm going to tell y'all, as a lay person out in the public going to a private provider, not to knock them, God bless them, they do a great job, but we give so much more education here. I just think that component at the health department is our strong suit. There is more one-on-one time. spent between the nurses and the patient. And those ladies are great. They're absolutely wonderful. Phenomenal clinic of nurses over there. They will make you feel comfy and cozy and just warm all over. I mean, they're just wonderful. They know their stuff too. You talk about getting comprehensive care. That's a great place to be. So there, I, in the pregnancy test care clinic, can then set up the appointment for the patient if they choose to come to us. And if they're not high risk, we are a low risk clinic here at the health department. That means, no complications in previous pregnancies. There's a whole myriad of things that can make you high risk, which we discuss in the pregnancy test care process in that clinic. If you are high risk, though, we do have a resource for you in our partner, which is Cape Fear Valley OBGYN. That's who, helps us with our pregnant ladies. So all that is available here. There is pregnancy care management as well, which is a resource in the health department available. It is a team of social workers. There are some nurses too that do that, where they can guide you through the whole pregnancy process, whether it's a teen, on up through adulthood. This is a one-on-one person that you have to let you know how, where do I need to go for my care? How do I get there? What are some resources if I need things for the baby? If I have social work concerns going on as far as abuse or neglect or whatever's going on in my household, I have all these other things going on that are distracting me from having a healthy pregnancy. That is a person that can put you in contact with the resources in Cumberland County that you may need.
Yeah.
So there's really a comprehensive group of people here geared toward folks having a healthy pregnancy.
Yeah. And you mentioned, that the health department overall, we are very serious about education. And you know that because, Delane and I are a part of the health education division. So we take education and giving out resources very, very seriously. Right now, both of us are gearing up for Sex Ed for All Month. That's a lot of...
What is Sex Ed for All Month?
Sex Ed for All Month, a long time ago, it was called Teen Pregnancy Prevention Month. But around 2013, a couple of nonprofits really wanted to get the name switched because they felt like teen pregnancy prevention was almost a little bit, they didn't want to shame anyone, like, especially if you're 19 years old and married and you're having babies, like they didn't want those young parents to feel shamed for being pregnant and under 20 years old. And so they also felt like for awareness months, it's not our job to tell people, how and when you should be getting pregnant. And so they wanted to switch it to Sex Ed for All Month to really focus on education. So not just about pregnancy, but all of education. So focus on basically like a comprehensive sexual education.
When you have this Sex Ed for All Months, do you do outreach? Do you do, what is some things that happen during that month?
Yeah, so we do some special outreach. So Sex Ed for All Month is one that I really take a lot of part in. And so I am doing a couple of community outreach like events geared towards middle schoolers. And it's basically just trying to incorporate comprehensive sex ed. It's something that we do all over the place. I know that Delane has done a lot of work with Methodist and Fayetteville State, also going into the middle and high schools. But comprehensive sex ed is really, really important.
Why is it needed, do you think?
So comprehensive sex ed is more than just it's more than abstinence only, which I know like a long time ago, a lot of sex ed was just abstinence only, but comprehensive sex education is about things being medically accurate and going over more than just intercourse.
Right.
And so like in North Carolina, North Carolina law says that we do have to offer in our schools medically accurate sex education. Not every state says that. So across the country, it's up to every state. And so fortunately, North Carolina said, yeah, let's do that. Which is, I mean, when I was in high school, it was abstinence only education. And so there were a lot of things that, you know, my age group did not get. But when me and Delane go into the schools, we're able to give them so much more information that deals with all these questions that they have.
What kind of
And
questions?
it's amazing. Oh, I'm
Go
sorry.
ahead,
It's amazing the questions that we get
I was
that
gonna
are
say,
so, where'd you
what
get that
kind of
from? You know,
questions,
you're like,
right.
wait a minute.
Yeah.
And so when we go into table or whether we go into school to educate, we're giving them the accurate information because we can clear up a lot of things that are just way, way off. And then they can do it in a safe environment. We can give out little slips of paper that we will give them to say, write your questions out. I don't care what it is, write it down, and we will try to answer by the end of class. If we don't know it, we'll tell you we don't know, but we want them to go out of there with the correct information. We also
Yes.
get into, if you're going to get into this big act of sex, we want to make sure that they understand about consent.
Mhm.
Yeah.
They want to know, we want to make sure they know about what healthy dating looks like and how to communicate. If you're not able to, if you're giggling to talk about it, maybe you need to maybe slow down a little bit or really find out what this is all about. So it's just not, you know, just the sex part, but if we break it down to understand this is a type of environment that you're going to go into that you want to know all the answers that you can. So we do it in a non-threatening way, a fun way for them to write down questions that they've heard or they actually want to know themselves and they don't feel, you know, weird or goofy because they don't have to put
Yeah.
their name on the paper. We can get that information
Yeah.
out to them.
And some of the questions that were asked, because I mean, as adults, you know, we have this knowledge that we've gained through experience, education, and so sometimes we kind of forget where these kids kind of start
Mhm.
with thinking about sex. And we did, Delaney and I actually brought a few questions that we've been asked in the schools because we've been to a handful of high schools this year, this calendar year alone,
Right.
also a handful of middle schools. And so it's, you know, we want kids to ask us questions. We want these students to ask us questions because it's important that they have their questions answered, but it's also a really great way for us to know where they're at.
Right.
What are they
Right.
needing? So, I mean, one student basically asked, can oral sex get you pregnant? And so, you know, that day we kind of had to have like a little biology lesson
Mhm.
about the reproductive system. I will say the teacher was disappointed that their student asked this question. But still, I mean, those are some things like, because she said, we went over
Oh,
this.
that's right.
And I said, maybe they weren't here that day. We had one student ask, is having sex the only way to get an STI? So in that case, you know, when kids talk about sex, they're talking about vaginal sex. And so this is a chance for us to educate about other forms of sex and how, you know, an STI is not just going to be a part of your reproductive system. So we talk about, you know, how these infections can affect your mouth and throat, your eyes, you know, the rest of your body. We had one question, do lesbians need condoms? And so some of these students that identify as queer, you know, they're not getting the information that they need. And so we know that we need to incorporate more, you know, of a cultural thing in there.
So just this week, I had one that was, the question was, can the condom break while having sex? And so during that, we went through and talked about how the condom, you know, how it's made and all that type of thing, what things would be put you at a more of a risk. And so some of these things they just didn't know and want to know about. And so that gives us, like Samantha said, an opportunity to explain exactly what you're about to get in. maybe you're not quite ready to have sex yet, but at some point when that arises, you will have this information that we give to help. I remember when they said that when they came to our school. So it kind of educates them earlier, to kind of know the correct information. So they sometimes want to know, what's the best age to have sex? I can't tell you that.
Right.
It's going to be different for every person. It's a personal thing that I can't tell you when to do or don't do, what kind, I can't tell you that, but I can tell you, here's what it is. Here are your risks. Here's how you can better protect yourself. So that part, we're able to do that when we're in the schools and in the community, and when we're tabling and we have people come up, well, what's this for? What's this pamphlet for? We're able to educate them on
that. And I will say this question, what's the best age to have sex? This was probably one of my favorite questions because it gave us a chance to really reiterate what our job is in all this. Our job is to give you the education and the resources that you need to make the best decisions for yourself regarding your health. And so, with some of these questions, like, can the condom break? As an adult, it can break. But what these younger students, ages 12 through 12th grade, those are just not things that they automatically know. So it's really, I do think it's difficult for some adults to remember that our young people are starting at ground zero. Like, they don't have knowledge.
Well, and the reality of it is they're getting bombarded with a lot of false information too.
Exactly. And it's really hard to weed
social
through.
Media and everything at their fingertips anymore, all this information, you got to really be mindful of that they are getting some false things in there too. So to have a resource like this where you give them the truth.
Yeah, absolutely.
And give them a way to ask their questions where they may not be able to ask that to any other adult in their life, and know that they're getting a reputable, or however you want to say it, the right answer. Something that's not Wikipedia.
Right.
Dr. Google, as we like to say. Maybe.
And I did want to share, I have a PowerPoint here. So this is basically just some information that we share when we go into the schools. Some of the most common contraception and barriers that are also available at the public health department. So with the students, we go over external or male condoms. We go over how to properly use it, what they're used for, different materials. We also explain that, when you look up the how, if they prevent pregnancy and how, if there's a failure rate, we let them know that real world use is only 87% effective. But that's why we go over how to properly use a condom, how to properly dispose of it, so that you could get that 98% effective rate that it's supposed to have. And of course, we always remind them, condoms free at the health department. Like, come see us, always free.
Get them. We got so many of them. Don't ever pay for a condom.
Exactly. And then we also go over, there are internal or female condoms because, even when I was in high school, I did not know this existed until after I graduated college. So going over how effective they are, how to properly use them, letting them know it's basically the same thing, except it's going inside of a body instead of externally on the outside. We go over birth control methods, so birth control pills. And now we can, let people know about the FDA approved over-the-counter birth control pills. So to make sure they look up information about that. The implant, we've had a lot of students ask about the implants and Nexplanon. I think a lot of students are interested in LARCs, the long acting birth control, just because we've had a lot of girls say they cannot remember to take their allergy medicine every day.
And the LARCs are really good method, and there's several different kinds. too.
Yeah.
So I always tell people, if you don't like one,
Yeah,
you
try a
can
different
definitely
one.
try a different one.
Absolutely. And so we do go over also the depot shot, because they've also heard about that a lot. Injection every 3 months. But when we typically tell them, if it's time to get your next shot and you're more than 2 weeks late, that's an issue. You need to be real careful, because
Yeah,
you
make
get
sure
pregnant.
you're using a condom
Yes.
as a backup until you can get on back in and get back on that
Yeah,
shot.
so
And always, make sure that if you miss your shot and you're our patient, come call us right away.
yes.
We do give you that 2-week period of time that we can get you in. If you're within that window, you're still safe, and we can get you in a lot of times, same day, next day, to get that shot if you discover that you've missed your appointment. But also use a backup method for sure.
Yes. Keep track.
Mhm.
Keep track of that 3 month.
Yeah.
And then we go over IUDs, the two types, the hormonal versus non-hormonal, or the one that's made of copper, the differences between those. But we make sure to remind everyone that these birth control methods do not prevent against STIs and
Yes.
HIV.
Right.
So only condoms of these condoms are going to help you prevent STIs and HIV. And that's why it's really, really, really important to communicate with your partners and come to the health department and get tested. Super important. And where can you do that? The Teen Wellness Clinic.
Yay.
So like we've said all day, super confidential, high quality reproductive health services for 12 to 19-year-olds.
Mhm.
You get testing, education, STI treatment, birth control education and services. No insurance is needed, but it is very welcome. And again, very confidential. If you do not want,
Yes.
if you are, anxious about an adult in your life, knowing that you have an appointment here, it is confidential.
Right. And it's so easy. We have
Yes.
a lot of availability. And you can also, I like to mention this too, get an Uber ride to and from your
Yeah.
appointment. So,
But you do have to be 18 to get the Uber help.
okay.
Yeah,
Thank
you
you
do have to
for
be
telling me
18
I learned something tasty there.
to use our Uber help services. But Uber help services, that is a free service where if you call and say you have an appointment, we will send an Uber to go pick you up, bring you to your appointment, and then take you back to your original location.
And you do need your own car seat. They don't provide the car seat, so you
Yes.
need your own car seat.
Yes. Yeah. But that's pretty much, that is, what we've got going on. We do have some things coming up. Just wanted to remind everyone that for all Hello Health, if you want to submit a question ahead of time, you can email us at hellohealth@cumberlandcountync.gov. However, you can always ask questions or make comments live in the question and chat boxes. And I know that what we've talked a lot about is some really, a lot of heavy healthcare stuff. So just to bring a little lightness to the end of this, today is National Bucket List Day. Do y'all have anything on your bucket list?
I want to go to Europe before I pass away from this earth. If the Lord will let me get across that ocean, I would love to go over there and tour around over there. I just think it's probably very beautiful.
Yeah.
What about you, Delane?
I have always had on my bucket list 2 things. It may sound goofy, but I do want to do zip lining, and I want to flip that big, huge tire. You know how when people work out, I want to flip the tire.
I want to flip a tire.
I want to flip
Oh my
that big
God.
tire just to see if I could do it. So
Hilarious.
it's on my
That's
bucket
hilarious.
list.
You know we have a zip line.
Yeah.
No.
Yes.
Okay, when this is over, we'll talk.
Ramsey
Yeah.
Okay, you have to fill me in. I'm a newbie here, so fill me in.
Okay. And then the thing, I have one thing on my bucket list, and I really want to swim with manatees one day.
Oh, wow.
Yeah, I do.
That would be you. That
I
would be
know, I
you.
know. They're so cute. So some things that are coming up at the health department. So we have an event for middle school age girls and boys. The one for girls is called Empower Her. It will be on May 17th at 6 o'clock at the GB Myers Rec Center. We're going to talk about communication, mental health, tobacco and vaping, puberty, body image, being confident, all that stuff. And then for boys, this would be the same, basically the same information, but geared towards boys. And there will be some men presenters there. Same location, GB Myers Rec Center, just on the next day, Saturday, May 18th at 11:30. If you have any questions about that, you can contact me, Samantha Tillman, at stillman@cumberlandcountync.gov, or you can give me a call at 433-3893. We do have a community health and resource fair coming up on May 3rd. That's going to be in Spring Lake at the Spring Lake Resource Center. So there's going to be door prizes, music, food, and there will be a mobile medical units available as well. So please go check that out. And then the last thing, we have Sunbucks coming up. So this will be North Carolina's newest food assistance program that's going to begin the summer of 2024. So to see if your family qualifies, just go to ncdhhs.gov/sunbucks. And then just for next month, just join us on May 22nd, where we will be talking about Triple P, the positive parenting program here on Hello Health.